We have to understand your hair growth has a cycle. When you are young, your hair growth will grow very fast. You're always in the growth phase. We call it the anagen stage, Then they will start to detach, okay, because of lack of nutrients or as you age, okay? And then you will move to the telogen age, which is the resting phase. And after some time, the hair will, this is a stage where your hair will fall, but you have to remember, sometimes after the falling, they never go back to the anagen stage. That means they don't grow back. So this is the painfulness of it. So if you look at the chart on your right, you can see the picture is different. Okay, your stages are getting lesser with the green. With more with the green and lesser with the blue. Okay, we want to move them to the blue. We don't want them to be all in the green, because if everything is in green, means you don't have the hair anymore. All right. Now someone is asking me, can I reactivate my follicles? As long as your balding hair is not shining, that means there's no hair follicles there, okay, we can actually reactivate the follicles. So they also come a situation, people asking me, Mike, you've been saying so much about the hair. Have you done anyone with white hair turning into black hair? My answer is no. Okay, but in my own experience, with our clinics, 26 of them across the world, including our German hospital or our medical center in Switzerland and Germany, we are doing a lot of patients, obviously, okay? And also many in Asia, including Malaysia. We have 3 clinics in Malaysia, okay? Wellness clinic, biological wellness. So what we do is that, my experience is there are 3 patients with our treatments, and one is a kidney patient. After improving on his kidney, surprisingly, he turned from white hair back to black hair, But that was a miraculous situation. I will not tell anyone that you will turn white hair into black hair. The important thing is keep your black hair and don't make the white hair to come out. Because once you have the white hair coming out and you start to pull the white hair, the hair which come out from that will also be white. It won't be black. So we must make sure that we try to delay the aging process of your hair too, okay? Because you start to age at 30 with your hair. And with the hormones loss of 1 to 2% after 40, you're losing a lot of hormones for the male and the female, because menopause is coming in, andropause is also coming in. So we will continue to lose more hair, okay, with the hormonal changes. So important thing is, make sure you have a balanced hormones, make sure all the organs are healthy, make sure you provide the nutrients to the hair. Then your hair will be as thick as you want to. Okay, we try not to lose the hair. Next, please. So what is this HFR extract? We call it the hair follicle extracts. Okay, like I say, we are coming up with a patent on this to protect the formula. It has been sold like hotcakes during the COVID in Malaysia and during the COVID all over the world. In fact, even in China, the Chinese make a big order with us to the extent we cannot even ship enough. It's because everyone is so stressed. Okay, when you're stressed means you will lose hair too. Okay, and it is very common in any parts of the world. There's a lot of males after 30, they start to lose hair. Okay. So if someone would have asked me, what about your mother and your sister? I only have one sister, she's 1 year older than me. Her hair is all white. Her hair is all white. My mother's hair is all white, but my mother is 90 years old. So it's different. My sister is 59 years old this year, and she is all with the white hair. And she don't have a stressful job. Okay, her job is very easy job, 9 to 5 job, Now, again, this, you have to understand, you are losing hair. It could also because you're doing a lot of color treatments. These are chemicals, okay? They will kill your brain cells too, okay? They will kill the hair follicles in a way, okay? Because they're chemicals. So you must maintain a healthy scalp, okay? To provide the nutrition to the hair follicles all the time. Because you must have strong and thick hair. If you are having thinning hair and the texture of your hair is lesser, that means your hair is not strong anymore. Do you know your hair for a redhead you will probably have around 80,000 strands of hair. For a black hair, you will have 100,000 strands. For a blonde hair will have 140,000 strands. Can you imagine? So if you're really born with a blonde hair, you have more hair. Okay, what about brown hair? Some of us have brown hair. You have around 110, better than the black hair. So if you are having healthy black hair, means you are good actually, because you only have 100,000. Okay, next please. And your hair is very strong. You can even pull the whole 10 tons of the whole hair can pull a 10-ton vehicle. That's why you see a lot of people pulling their hair pulling a vehicle, with their hair, because your hair is made of keratin, just like the one in your nail. They are very strong. They are all the cables there, very strong cables, okay? A combination of cables. Now, again, the one we have here is just like a super multi-white for your hair and your skin, because they have everything there to promote the tissue, repair the growth, the collagen, the hyaluronic acid, everything is there, okay? Again, with all these growth factors, all the vitamins, antioxidants, and cytokines, of course, you will have good hair then, okay? Because you also have to take care of your hair, just like your other parts of your body. Next. So what about the hairspray? Now, the hairspray is because some of us may be very lazy to be stamping on our hair all the time, right? So because of that, we came up with another formula made in Switzerland, okay? You only need to spray on the hair. That means it's like that, okay? It's like that, and I just pull it up, and I spray on the hair, on any part I want. So after shower, I will just spray on the hair, and that's how it goes. And it's so easy. I will go with this, and then I will show you a demo afterwards. Next, please. Now, these are the treatment. These are the steps. We have the instruction, or we have a video. We have a pamphlets, like I say, in the packaging. So you wash your hair. Make sure the scalp is clean and non-oily. You have to have a non-oily hair for better penetration. So on a dry hair, you apply the HFR stempel every 3 to 5 days, once every 3 to 5 days. Okay, I used to tell the clients 1 week, they still grow hair. Okay, but recently I told them, some clients asking, hey, Mike, I think I want to do it 3 days now, because I don't see a problem at all. Why must I wait for 1 week or 5 days? So I say, no problem. If you are free, do it 3 days then. Because it's so easy, you won't take a lot of your time. You can do it while you're watching TV or while you're reading newspaper or anything else. Okay, it doesn't take a lot of time. All you have to do is load it in and then just stamp on it and then wash it up and put it back, into the fridge. Everything will be kept in the fridge, including all the wires, unused wires, they're all kept in the fridge. You only take one out, okay? What about the spray? Again, the spray is without chemicals, okay? So you also have to keep in the fridge, okay? You keep in the fridge so that it's cold, because it preserves the quality of the product, because this product cannot be heated up, okay? When you heat it up, means a lot of bioactiveness will be gone. These are stem cell peptides. Next, please. So the spray will come in such a way that after stamping, okay, on that day, you don't need to spray. But other days when you don't stamp, after washing your hair, at night, you can spray, and then later on you go to sleep, okay? And they will work better at night. But there's nothing wrong to spray in the morning and then you spray another one at night, as long as you're on a dry hair, okay? Now, again, we have been doing a lot of studies on this. Last year itself, we did 4 publications on this, because we cannot tell everyone that it works, because you go out in the market, in the pharmacy, in the supermarket, there's so many hair shampoo, hair products, hair tonic, everything. And you do not know which one really works, right? So you must have proof. Because anything you promote to a medical doctor, he will say, I want the evidence, I want evidence-based. So this is what we do. It is always my interest to ensure that it's proven by science. So we get our aesthetic doctors, we treat a number of people, and we start the treatments. Okay, one was on the eyelash, and one was on the eyelash and the eyebrow. Okay, and it was done totally in Malaysia at that time. Okay, it was not done in Europe because at that time it was a lockdown, but we still managed to do it well. Okay, next. So we have 4 publications to support them. And this is good publication. Of course, we also have other publications which support the treatments on the face. We didn't put it up here, but the rest are all here. Okay, we work with our German university, in Heidelberg University to provide some new approach on the dermatological side too. Okay, we work with one of the top dermatologists in Sabah, and he's a close friend of me, Dr. Glenn Elwin, and we've been on together for 20 over years on all this stuff. Next, please. Now, this is one of the things. This is actual patients in the publications where we prove, that the eyebrow does grow, okay, over a 12-week baseline, from the baseline to the 12-week on the studies. And this has been published in UK. Okay, all the publications are done in UK or USA. Next, please. Now, this was a guy who was doing it with one of our aesthetic doctors, who told me about and sent me this picture, and that the guy is growing the hair. Okay, this was before the COVID incident. That's what also encouraged us to come up with more hair treatments. This was sent by one of the doctors, a lady aesthetic doctors in Kuala Lumpur, about her patients, growing the hair with our treatments. Okay, at that time she do it with aesthetic treatment. Next, please. Now, this is my old friend for 30 over years. He's a phone guy who supply phone to me. I buy a lot of phones. Okay, we have 300 over staff, and we keep changing phones. And I always keep the latest phone. And I will always change to the latest phone because I believe in technology very much. So same with what I'm doing in stem cell research, with peptides, with anything I'm doing, it must be upgraded all the time. Same with nutrition. We do a lot of things with nutrition. So same for the phone. I must have the latest phone because you have better memory, sharper pixel, more pictures, sharper pictures, all kinds of things come in, okay? So here what he did is each time he come to me, I notice he's losing a lot of hair and he's much younger than me, okay? And at this time, I told him, why don't you do something on your hair? You look so old to me, at 55. And Peter, his name, he told me, Mike, I've been to everywhere. I do not know what to do. I only know I'm under stress and I keep on losing hair. Sales are bad these days, So I told him, simple, come every week. I will ask my nurse to do it for you. And he really did every week with only 2.5 wire, only 1 wire. Okay, he came and do it over 3 months. Every week, that means you come only 12 times. No? This is a picture of over 12 times. He sent this picture to me. It's not I who took the pictures or we who took the pictures. He sent it himself and he said, Mike, I'm so happy you did this for me. And he encouraged and recommended a few of his business friends after that. So that's how it goes. And this is only 1 wire a week, Can you imagine? Okay. And he didn't continue with the hairspray after that. Okay. But of course, with the hairspray, it can even be faster. Imagine if I were to use 2 wires a week. Imagine if I were to use every 3 days instead of every 7 days. Next, please. Now, this is done on the VVIP in KL during COVID in March, You see that it's around the COVID time, And my doctors had to go to the house to do it. And the reason he saw me in Philippines at that time, in the clinic, and he asked me, Mike, what do? You do your hair. How come your hair so thick one? Okay, I'm losing hair, So he show me his part and say, okay, simple, this is taken by a cell phone. Even that, he can show that he's growing hair. Okay, and again, those days you only use 1 wire a week. I will not, if I were to do it fast, I may not even use 1 wire a week. I may use 2 wires, every 3-4 days, and you'll be very fast. Okay, next, please. Again, this is another one in KL, Kuala Lumpur, and it was a very quick one because this guy was not a very disciplined guy. That means certain time he comes, certain time he don't come. Okay, and still I see some results. Okay, next please. Now this is a very difficult case. He has been to all the hair clinics around KL. He's a KL patient, who comes to KK, because he's desperate, and I've been treating him for wellness all the time. And one day he asked me about the hair. So he was having very difficult time treating the hair, and he has paid a lot of money to get it done, and he couldn't get results. So I did it with him with just the mesotherapy. Those days it's mesotherapy last year, 1 needle by 1 needle, okay? It's more painful with a 33 and 34 gauge, which is supposed to be the minimal pain, but he still don't grow the hair, okay? But with our method, even with a mesotherapy, he grow the hair. I'm very positive that if I were to use the stemple today, he will grow more hair, So next, please. So in the same way, we can grow the beard of the male if they want, and the sideburn. The growth of the sideburn, we do the same of the hair. Next. So it's the same thing, but again here, we also have a different formula for the sideburn and the beard because it works differently, okay? It's worked differently and it's only for the male. You cannot use it for female for this. Next, please. Now, eyelash. This is another one where a lot of ladies is asking me. I buy a lot in some of the centers, I bought in Watson, Guardian, Shao, or whatever, There are some which seems to work and some which don't work, okay? So I gave him the simple example. If you use an A for A, obviously it will work.